Health officials are trying to trace the route of a woman who came back from India with a drug-resistant form of tuberculosis.
That woman spent time in Missouri before she was hospitalized. And KRCG 13's Garrett Bergquist joins us now in the studio to explain how much of a risk that poses to the public. Garrett?
Health officials aren't saying where in Missouri the woman went or how long she was in the state. A doctor says your risk depends on where and when you are exposed to someone with tuberculosis. The Centers for Disease Control says a woman arrived at Chicago's O'Hare International Airport with a drug-resistant form of tuberculosis. The woman spent time in Missouri, Tennessee, and Illinois before she became sick.
Tuberculosis causes, under most circumstances, a respiratory infection, a pneumonia.
Tuberculosis kills about 1.5 million people worldwide each year, but is rare in the United States. McNally says Capital Region Medical Center doesn't even see one case a year. Tuberculosis is spread through a sick person coughing, sneezing, or talking, but it's not easy to catch.
If you're in a large area where someone with active tuberculosis has been, just by mere virtue of the expansive area, the likelihood of actually breathing in the organism is markedly diminished.
Someone exposed to the tuberculosis bacteria can carry it for the rest of their lives and never get sick. So-called latent tuberculosis can't jump to another person. But if a person develops symptoms, they have a long road ahead of them.
It's not a take one pill a day every day for 10 days like many infections are. Realistically, it's take multiple pills every day for 6 months.
The woman with tuberculosis is being treated at a National Institutes of Health facility in Maryland and is in stable condition.
There should not be excessive fear associated with this recognition of an active case of tuberculosis. I assure you, these cases were on our shores before this lady came from India, and they will be on our shores and and in our country for all the years to come.
Tuberculosis symptoms include chest pain, fever, a bad cough that lasts 3 weeks or longer, and coughing up blood. McNally says if you have these symptoms, you should talk to your doctor about getting a test.